Respiratory syncytial virus (RSV) is a highly contagious virus that primarily causes respiratory infections in infants and young children. Although it can affect individuals of all ages, it is a leading cause of bronchiolitis and pneumonia in children under 1 year of age. RSV can also cause significant illness in elderly adults and those with weakened immune systems or chronic respiratory diseases. Overview: transmission. RSV spreads through respiratory droplets when an infected person coughs or sneezes. It can also spread by direct contact with contaminated surfaces or objects, followed by touching the face, particularly the mouth, nose, or eyes. Seasonality. RSV infections are most common in the fall and winter months, with peak activity often occurring between late fall and early spring in temperate climates. Symptoms of RSV typically appear about 4 to 6 days after exposure to the virus and can range from mild to severe. Common symptoms include mild symptoms: runny or stuffy nose, cough, sneezing, low-grade fever, sore throat, wheezing, a whistling sound when breathing. Severe symptoms: in more serious cases, particularly in infants and those with underlying health conditions, RSV can lead to difficulty breathing or rapid breathing, high fever, bluish color of the lips or face, cyanosis, severe wheezing, dehydration. Diagnosis of RSV typically involves medical history. Healthcare provider will assess symptoms, medical history, and potential exposure to RSV. Physical examination, evaluation of the respiratory system, including listening for wheezing or abnormal lung sounds. Laboratory tests. In some cases, laboratory tests may be performed, including nasal swab. The sample may be taken from the nasal passages to test for RSV through polymerase chain reaction (PCR) or rapid antigen tests. Blood tests. These are less common but may be used to assess the severity of illness or rule out other conditions. Treatment. Most cases of RSV are mild and can be managed at home. Treatment options include symptomatic care, hydration, ensuring adequate fluid intake to prevent dehydration, rest, allowing the body to recover with plenty of rest, pain relief. Over-the-counter medications like acetaminophen, Tylenol, or ibuprofen, Motrin can help alleviate fever and discomfort. Monitoring. Close monitoring of symptoms, especially in infants and high-risk individuals, is crucial. Hospitalization. Severe cases may require hospitalization for supplemental oxygen to maintain adequate oxygen levels, IV fluids to prevent dehydration, bronchodilators or nebulized treatments for wheezing. In severe cases, mechanical ventilation may be necessary. Preventing RSV infections can be challenging, but several strategies can help reduce the risk, particularly in high-risk populations. Hygiene practices. Regular hand washing with soap and water, especially after being in public places or after contact with an infected person. Avoiding close contact with sick individuals. Cleaning and disinfecting surfaces that may be contaminated. Avoiding crowds. Keeping young children, especially infants, away from crowded places during RSV season can help reduce exposure. Palivizumab. For high-risk infants such as those born prematurely or with certain heart or lung conditions, a monoclonal antibody called palivizumab may be administered as a preventive measure during RSV season to reduce the risk of severe infection. Prognosis. The prognosis for RSV is generally good, especially for healthy children. Most recovered fully within 1 to 2 weeks. However, RSV can lead to serious complications, particularly in infants, the elderly, and those with underlying health issues. Severe cases may require hospitalization, and some individuals may experience recurrent wheezing or respiratory issues later in life. Conclusion. Respiratory syncytial virus is a common viral infection that can lead to serious respiratory illnesses, particularly in young children and vulnerable populations. Awareness of symptoms, effective prevention strategies, and timely medical care are essential for managing RSV infections. If you suspect someone may have RSV, particularly if they are at high risk for severe illness, It is important to seek medical attention promptly,